Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Let's go!
Health matters to me.
Come on, get up, cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's a lifelong dream goal.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jackie and Coach Patrick right here. Let's go.
Health matters to me.
Welcome to Health Matters this morning, guys.
Let's
Good
do that
morning
again,
to you.
'cause we was muted.
That's all right.
Do the
Good morning.
Yeah.
Good morning, everyone. This is Jackie.
And Coach Patrick.
Guys, thank you for joining us this morning on Health Matters podcast, guys, where your health matters.
Every day, all day. Listen, we want you to join us right here every Saturday at 9 a.m. as we bring you relevant information pertaining to your health and well-being. From time to time, we'll have professionals on the show with us to help us help you to be the best you, to be the better you that you can be as it pertains to your health and your well-being.
All right, guys, you already know what to do. Head over to Facebook and like our page, Get Fit with Jackie Fitness, and subscribe to our YouTube channel at Health Matters Jackie and Coach.
Yes. Do it now. Do it now. Share, like, subscribe.
Yes.
Let's build this.
Guys, you know what? We're in the month of April.
Brand new month. April
Yes.
showers.
April shower bring Mayflowers, but we done had more March showers than we had anything. But
Pollen.
guys, welcome to the month of
It's here.
April. Guys, you're celebrating a birthday anniversary. Happy birthday to you. I don't know anybody right offhand. I know my sister Susie in Mobile, Alabama.
Happy birthday.
She's celebrating a birthday this month.
Shouty.
And they call each other short, and both of them short.
Happy birthday.
So, yes, guys, happy birthday to you out there, guys. And here we're aware, guys, there's a couple of awareness things this month. I think one of them we know for sure is Autism Awareness
Well,
Month.
hold up. Let's happy birthday first. We're moving a little bit. too fast.
Oh, okay.
Happy birthday to everybody that's celebrating a happy birthday. We don't want to, short you on your birthday. This is your birthday month, so we wish you a happy, happy birthday. Those that are celebrating anniversaries, whether you tied to not jump the broom, however you did it, you did it. Build memories, build family, keep becoming one as you celebrate yourself and your anniversary. Again, happy anniversary and happy birthday.
All right, guys, we are welcome the Masters in this weekend, guys. So you know what we do every year. We set is from Sunday to Sunday.
Spring break.
Spring break time for the city of Augusta, and also we are welcoming in people from around the world to come and join one of the biggest golf tournament in the United States, which is the Augusta National Masters 2025, guys. So welcome, Patriots. Welcome. We hope you enjoy the city of Augusta.
Yes. Listen, we want to acknowledge our sponsors, partner, friend, Dr. Dan Jolich of Aiken Chiropractic. When your spine is aligned, your body is too. Aiken Chiropractic is located at 425 Lawn Street Northwest in Aiken, South Carolina. The number is 803-641-9191, and their website is www.aikenchiropractic.com. If you would like to be a partner, a sponsor, or friend of the show, please call 706-592-8862. The number scrolling at the bottom of the screen. We would love for you to help us do what we do.
All right. Good morning, Sharon. Thank you for joining
Good
us
morning,
this
Sharon.
morning. And those who would join later, thank you, guys. Now, guys, that pollen is up really, really high. To its highest. It actually went up yesterday. The rain kind of decreased it a little bit, but it is up as of yesterday. It went back up, and I can tell because my eyes. So, guys, be careful out there if you
It
deal
had
with
me
a
down
lot of allergies and people that never had allergies. It's bothering them. I tell you.
It
But
had me
yeah.
Tuesday, I tell you, and I ain't never felt that way Tuesday, but the way
Right.
I felt. And I usually don't deal with allergies like that, but it had me Tuesday.
Yeah, this pollen is.
But I was free now. telling you, when that allergy messing with you, boy, it's like you in woof.
I
Ain't no
know.
joke, man. So I know how some people feel with those things, because some people really suffer from allergies. I mean, on a daily basis.
Yeah. So, guys, we know April it has several awarenesses.
Hmm.
So, the one we're talking about today is
Autism.
autism, and we, autism spectrum disorder. Girls in autism, chronic disease, symptom treat. So those things is very important.
Hmm.
Um, when we was on the station, we had a guest that we followed these young boys, Jeremiah and Josiah.
For the last 8 years.
For the
Yeah.
last 8 years, we have had her, the mom, and she is so incredible with her children. I think they're in high school or one year to graduate, but she has done a phenomenal
Awesome
job
job. Yeah.
with them. She will be,
Defeated the odds.
yes, yes,
Yeah.
but she will be joining us later on in the month. But today we're just gonna highlight some clips from the past interviews that we have had with her. But they are doing so incredible. She have a Facebook page. They make me better.
Awesome
And yeah,
organization.
so
Yeah.
she got that, and so because she didn't know, how she was gonna be able to cope with this and deal with this as young boys with autism, because it's only had one, and then the other one started developing it as
Hmm.
well. So, but she's different with the help, with God's help and the help of her family and the church. She she overcame, she conquered and
Right.
overcame, and
Right.
they are doing so great. And so she had the they make me better, because she said I was helping them. She said they was helping her.
Yeah, that
And
was
they was,
awesome. Yeah,
yeah, they
that was
was making
awesome when
her
she
better.
said
So
that.
that's when
Yeah.
she have a Facebook page. You can go over there and like it. They make me better.
Yeah, you get a lot of information and resources, because, like I said, she's been uh, dealing and treating her kids for autism since they've been born, and like Jackie said, they're in high school now. So, and she's done a good job of helping them to make the adjustments to be, social, and be, social, so as it pertains to their social wellness, being able to interact with others. So we're going to get into this subject about autism spectrum disorder, actually. And autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. So the disorder also includes limited and repetitive patterns of behavior. The term spectrum in autism disorder is in autism disorder refers to the wide range of symptoms and severity, because it is a wide range, because the children may be challenged in different areas as it pertains to autism. So that spectrum is wide, because everybody is different, and we always say that. So some kids' severity may be worse than others, and those are some things that we have to keep in mind.
Yeah, and that's true. Coach. Well, like you said, she noticed it in one of them. I don't know which one. If it was Josiah, Jeremiah, that's their name. And then later on, the other one didn't begin to have showed symptoms of it until later on.
Hmm.
But and at the time when that was happening, there was no help
Right.
for
Right.
for autism
In this
here, the
area,
support
yeah, in this area, it was
in this
hard.
area. Not
Right.
that it wasn't, it's just one in this area was very limited. So she had to drive
To
all the
Atlanta.
way to Atlanta
Hmm.
to get her kids the help that they need. And so, like I said, she has an incredible testimony.
So to put a name to that we're
Incredible.
talking about Miss Lucretia Reeves and her two
Yes.
sons, Jeremiah and Josiah. And she's been on, like Jackie said, when we were on the radio, she was on our radio show. She's been on the podcast too. And she talked about, she's always giving us an update on where they're at. And we're gonna get her on the show this month to give us an update, to just to kind of, stay in that journey with them and their progression. Autism spectrum disorder begins in early childhood, and eventually it causes problems functioning in society, socially, in school, at work, things like that. Often children show symptoms of autism within the first year, but a small number of children appear to develop it. As Jackie said, one of her sons was born. You know, she seen the signs early, and one of them she didn't see it until later in his life. So, but as a small number of children, they appear to develop it normally in the first year, and then they go through a period of regression between 18 and 24 months of age when they develop autism symptoms. And one thing, Jackie, that was said as I was researching, it says that boys, there was a 2020 review done that showed that boys are 10 times more likely than girls to be referred for autism assessment. Now, I said referred, not that boys are more likely to get it, but it shows up because they're referred more for the assessments than girls. And
Wow.
then, and in 2023, there was a study that suggests that up to 80% of girls and women may receive a diagnosis of social anxiety, eating disorder, or borderline personality disorder before being accurately diagnosed as autistic. Now, there's a lot wrapped up in that, but I just wanted to bring that up. But if you want to get more information on it, there's a interview that you can pull up on Google with CNN with a Professor Gina Rippon of cognitive neuroimaging at the Aston Brain Center in Birmingham, England. It's about autism in girls and women and the challenges of current diagnostics and how they don't get diagnosed as much as boys, and how medical professionals can think differently about screening without any biases as it pertains to girls and women when it comes to autism. Some of the things I just wanted to point out in the interview between CNN and Dr. Ribbon was and Professor Ribbon was one thing she said was autism presents differently in girls versus boys. Girls who are distressed in some way very often internalize their problems. They become withdrawn and shy. They'll stand in the corner. They don't engage with other children. If you've got children who are shy and quiet and stand quietly in the corner, you aren't going to think there's a problem, and maybe you'll even move on. Not paying attention to it. If you've got children who are acting out by banging their heads against the desk or kicking, which is more characteristic of boys, those are the kids you're going to look at more closely. So one of the things the point she's trying to make there is that's why we get the boys diagnosed for these autism disease. When girls, they do it, handle the situation a little differently. And secondly, one of the things she said too, Jacob, was there's a clear evidence that girls try to camouflage or disguise or mask their problems.
Mm.
That happens very early on in age, at age 4 or 5. And lastly, I just want to share with you that in 1980s, a researcher named Dr. Lorna Wing, who was portion, partially responsible for broadening the notion of autism, said maybe girls are just better at disguising their problems,
Mhm.
and maybe girls are taught to behave better early on. It's not socially acceptable for girls to act out, so they don't. So I just wanted to share that with you. And if you want to get more information, it was a very good interview with Professor Rabun and CNN. You can Google that, and you can get the whole transcript. And it's a pretty good read if you have children, a girl or somebody that's being challenging in areas you just can identify what's going on. You may want to read that and look at that interview. Any comments on that, Jackie?
Oh no, that's a lot of information. I mean, you can see that, I mean, I can kind of see that a little bit, but there is help today. Is more help. We have different um, help fairs that support autism, doing things for more resource,
Mm-hmm.
for autism, and thank God for that. And
Mm-hmm.
the organization, um, Miss Reeves have they make us better. So just getting involved, being proactive with your children, because these parents, that's a lot.
It is. It's
That's a
challenging.
lot,
Yeah.
and you got to have the help of God and a good network of support
Mm-hmm.
from your families and friends and people that really understand. Because some people don't. Because I have experienced parents that have had have children like that, and they can
Mm-hmm.
act out,
Right.
and that can be very, it's sometimes embarrassing for them.
And see, and that's the
And
stigma associated with that too.
right,
People don't want to, have their children labeled or identified as something being wrong with them,
right.
and so they won't get them the help they need.
Right.
Yeah.
And Patrick and I, we have a niece, the one, just passed. She was diagnosed with
Down
Down
syndrome.
syndrome, you know. So, but her mother did a phenomenal incredible job with her.
That's
And
right.
and she lived to 58. They didn't expect her to
Yeah.
live until she was in her
But
teens.
20, yeah, some
But
20 years old, something like
but
that. Yeah.
she lived to 58
58.
years old. And so she just recently passed some weeks ago, but she did great with
Right.
her. She did a phenomenal job with her. So you have God, if it's like God won't give you more than you can bear,
That's right. Let's show these two clips because we
on it.
talked about
Yeah,
stigma.
yeah.
So I'm going to show two clips. These are some clips that we had from an interview with Lucretia Reeves, and so that you can hear it out of the mouth of someone that's actually dealing with autism, and just kind of listen to this for a minute.
My child had because I didn't know because it wasn't talked about a lot in the African American community. Just to be honest, only thing they will say is your child has a behavior issue or something of the nature. But us as parents, we have to be an advocate for our own child. We can't take what somebody say as the gospel. We got to know it for ourselves as well. Um, that's why the word tells us to study to show ourselves approved. I have to study the word.
That was a short clip there, and you can see how she said that as parents, you have to get involved. You have to seek out the information. You have to seek out resources to find out, and help your children to live the best life that they can. One more clip before we move on.
A lot of times in our community, and I don't want to just target to just our community, but a lot of times in our community, we're ashamed to admit that our child has autism or Asperger's or any or ADHD, anything like that. We're ashamed to say it. So, and for me, I went in hiding.
Now that right there, how she said I went in hiding.
Yes.
Talk about that, Jack. I'll be right back.
Yes. And that's what I was talking about. Some parents can be embarrassed about that. They can be embarrassed, and sometimes people that they don't understand. Other people don't understand. Like if you're in a restaurant, if you go out, some people just don't have the compassion and they just don't understand. So that doesn't make it any better for the other parent. The parent with the child, feel comfortable with their child, with their child's condition. So, but now it's better today. It's a little bit better today. People are more aware of it, and more understanding of it, so they are not so pushed out, because a lot of parents, when they go places, they get put out of restaurants, or they tell them they the child can't travel with them, or something of that behavior. So, but we're going to talk about some of the behaviors, guys, and some of the behaviors that's inappropriate in social interaction, and that's what we just said: poor eye contact, compulsive behavior, impulsivity, repetitive movement, self-harm, or persistent repetition of words of action. And so that's some of the things we just talked about, because they can display these type of behaviors when they're out in public. And like she said, she went in hiding because she was embarrassed about it. It was such a stigma, like she said, especially in the black community, So, but I thank God that people are more understanding now, and more acceptable of it, and not being so rude,
Yeah, one
and
of the
more empathy to these parents and
Mhm.
the children, and what, because they didn't choose this.
Right. And one of the things she talked about too was how, she just had to on purpose make up in her mind, this is what it is. And she started including them in family outings. She said she wouldn't go to family outings
Mm.
because, like, again, she said she was hiding. She didn't want to, them to be out and then start acting up and all of those things. So she made decisions that really wasn't helping them because she wasn't allowed them to be amongst people and interact with people because of the shame and of the stigma and stuff like that. So, we have to move past that as parents and try to focus on our children and helping them to adjust and in the areas that they are being challenged
And
with.
that's why support from your community is very important.
Most definitely.
Family, community,
Most definitely.
and bringing the awareness, so people know, hey, because you don't know in a given time, it could happen, it could show up at your house.
Mm-hmm.
How would you handle that? So that's how you have to look at it, and be more empathetic with these parents and the children,
Most definitely.
so.
So one last clip with Miss Lucretia Reeves, and we're gonna move on into the subject.
Do you think that helped them or hindered their development by you, being embarrassed by that?
At first, I think it really it hindered them because they didn't have the social skills, you know what I mean, to socialize with other people. And then when I realized keeping them away from people was hindering them, then I was like, okay, I started.
So there it is, straight out of the person's mouth that deals with this. It was hindering them to for because of her um, uh, personal issues with taking them into environments and around family and around friends and things like that. So let's talk about some of the common symptoms. Some of the common symptoms include difficulty with communication, difficulty with social interactions, obsessive interest, and repetitive behavior. Some people may experience some things in the behavior area like inappropriate social interactions, poor eye contact, compulsive behavior, impulsivity, repetitive movements, self harm, or persistent repetition of words or actions.
Yeah, I went over those a little bit earlier.
Okay, you
And
went
then,
over all of
yeah,
those?
and yeah, developmental, learning disability or
Mhm.
speech delay in a child, you
And we
know.
have to be aware of those things.
Yeah, we have to. And you have to look at that, in your children, and then especially if you having your grandchildren, you have to be able to identify these behavior cognitive,
Hmm.
intense interest in a limit number of things or problem paying attention.
Yeah, all of those are could be flags. The
Yeah.
thing is just get your pediatric or your doctor involved, family care provider, so that you can really identify these things. Don't try to self-diagnose. Don't call nothing on your children. But if you see things that raise a flag, then that means you need to get some attention to it. That could be some psychological things that's going on, like unaware of others' emotions or depression, deep depression for the children. And also, some common things are anxiety, a change in voice, sensitivity to sound, things like that. So, just pay attention to your children, and just know that boys and girls could be affected by autism spectrum disorder, and do the things that are necessary or you feel necessary that you need to do to get your child the proper help that they need, a proper attention.
Yeah. And some children can show these signs early, even in
Emphasis, yeah.
infancy. Like eye contact, lack of response to you when you're playing with the baby, a lack of response or indifference, to caregivers.
Hmm.
Other children may develop normal, for the first few months of years of life, but then suddenly becomes withdrawn, or aggressive or lose language, skills they already acquired. Sign use
Wow.
they that starts to decline,
Wow.
by age of 2. So that's why you have to pay attention to your children and don't look at it just as, go sit down and don't, pay attention to your children. Don't be, so not understanding and not saying, okay, wow, what's going on. Pay attention to your child, you know.
Especially if it's repetitive, something that happens all the
Right.
time, something that's happening once or twice, yeah. But if it's something that you're noticing that they're doing that's just,
If
you
it's
know,
consistent.
it concerns you, then yeah, there needs to be more attention brought to it. As we said earlier, because of the unique mixture of symptoms each child may have, severity can sometimes be difficult to determine. So it's generally based on the level of impairments and how they impact the ability of your child to function.
Yeah.
Again, pay attention to your children. While there's no cure for autism spectrum disorder, intensive early treatment can make a big difference in the lives of many children.
And that, I'm sorry, and
No,
that
go ahead.
also depend on, the severity
Hmm.
or the degree of the autism. And that's why I like, it's one of the interviews she said that's why you have to catch it early.
Yeah.
If you notice these things early, now we can kind of start doing
Working
something
with them.
about it. And that's some of the things that she recognized that she knew her children,
Mm-hmm.
and she knew Josiah, she knew Jeremiah, and so she immediately took action,
Mm-hmm.
and so that's why in hiding them it's not going to make their
Right.
development better, and it's not going to make them better. So you have to have, like you said, family members that understand. If they understand, they don't understand, you can't worry about that,
Right.
but you got to have a good surrounding of support of others.
Right. And then you need your family members to help you, and
Yeah,
understand. Just like Jackie brought up our niece Lynn, we included her in everything, so
everything.
we didn't pay attention to her Down syndrome. Everything we did, she was
She was
included in it,
included.
just like a regular normal family member, and that helps them, to be able to learn, to be able to
To
see how
cope, yeah.
right, how people interact and react to things, and it helps them to be able to better, live their life
Yeah.
with the condition that they have as it pertains to
Yeah.
autism. As we've been hitting on it, early recognition as well as behavioral, educational, and family therapies may reduce the symptoms and support development and learning. So that's the key right there. As you include them into these events and things like that, it supports their development. It supports their learning on how to be in certain environments and certain events and things of that nature. So it helps. It helps a lot. It helps tremendously. I think
Yeah.
one of the things that Miss Reeves said was that was what really started to turn them around when she started including them,
Right.
and stop hiding them. She
Right.
started including them.
Because she
So
was trying to please the people. She was
right,
embarrassed,
right.
because with people, their reaction to that.
Mm-hmm.
But if you're one of those parents, if you're concerned about your child's development, or you suspect that your child may have autism spectrum disorder, discuss the concerns with the child health care provider.
Mm-hmm.
The symptoms associated with the disorder can also be linked with other developmental disorder.
And that's why you don't want to diagnose. You let the doctors
Right,
do it because it
right.
could be something else that's a developmental disorder. It's not necessarily autism. So, yeah, that's why you always want to get your healthcare providers involved because it's a spectrum. So there's a lot of different things that can be going on if something is going on at all. As far as therapy, family therapy, make sure everybody's on board and
Right.
understand that, hey, we're gonna deal with this as a family, and when this person or this child come around you, then we're gonna treat them as normal as we can to help them to uh, develop and learn how to be in certain situations and
Right.
environments. I think that plays a great big part of it,
It does. It
because a
does.
lot of times the kids that deal with these autism spectrum, they just slowly in developing and learning. So,
Hmm.
we have to take more time with them and be
Yeah.
more patient with
Yeah.
them.
And I think the frustration comes because they want to do more. Inside of them, they probably like, God, I want to do this. And I think that that's what
They
really caused all
frustrated.
the frustration and
Hmm.
inside of them. I really believe that's me. I believe
It could
that,
be part of it, most
you
definitely.
know.
Yeah,
So, but they are people too. They
most
are God.
definitely.
They are God's children too.
Hmm.
So, but I applaud the mothers,
Right,
that have to help groom them
right.
and rear them in life, because the mothers themselves have to face ridicule, or
Hmm.
you know embarrassment, or just things from other people that
Hmm.
don't have an understanding, and it's not as sympathetic
Right,
to them. So the mothers have has goes through a lot as well. So
right.
I commend the parents. And
And you're saying something there because we know that Lucretia and she shared it. So she had her husband left. She was married and her husband left. So mom, dad, we have to work through these things together.
right.
We have to become one. We have to become strong. We can be stronger together, and we can deal with this. And it's better for both of us together. So if you're married and your children are doing these things, then don't bail out, on your spouse. I know there could be a lot of other things that's involved in that, but if it's solely based on your kids are dealing with challenges in their life, we have to stick together and see those kids through it. It's not about us. We have to make the greater sacrifices as parents when it comes to our children.
Yes.
And they didn't ask to be the way that they came into this world. So if they come into this world a certain way, then we as parents have to take the high road and be men and women of God and know that God is going to work with us in order
Stewardship.
to help our children to be the best that they can be so that
Mhm.
they can live out their life just like we're living
Yeah,
our
we
life.
have to. God gave us responsibility to
Right.
steward them and train them in the way they should go. Now,
Yes.
whether they have a different development area than another one, they're still human,
That's right.
and they still deserve to be treated equally and,
Mm-hmm.
and just as anybody else. And that's why, Patrick and I understand, with our niece,
Mm-hmm.
being with her ever since she was little. We included her in everything,
Right.
everything. She was not excluded out of nothing,
Sure wasn't.
nothing,
Yeah.
nothing.
So, and that's what it's all about. So, autism spectrum disorder, like we say, it is serious. It is there, and it is said that boys are recognized for it more than girls. But just be cognizant of that, Jackie.
Yeah. So, guys, that's the show. We just I know it's a little shorter than we have, but this is the first of the month, and this is Autism Awareness Month, as long as with others, and we will be bringing those. So those different topics here, because we're here to bridge the gap, guys, to connect the community and bring you relevant information that pertain to your health and well-being, guys.
Right.
So this is what we hear. This is our mantle, and this is our platform, and this is what we do. So, and we enjoy doing this. A passion. We do it with love because that we want to see people better, because your health matter. It does matter. So,
Every
guys,
day, all day. So
all
listen,
day,
guys,
guys.
thank you for listening to Help Matters. We want you to like our Facebook page at Get Fit with Jackie Fitness and subscribe to our YouTube channel at Help Matters with Jackie and
And
Coach.
guys, remember, we're here to help you to become a better you, to be the best you that you can be. We like to leave you with 3 John 2. I wish above all that you may prosper and be in good health, even as your soul prosper. Guys, you go out and have a healthy and blessed Saturday. Enjoy your spring break. If you're going to the Master, enjoy the Augusta National Master 2025. We love you guys, and we'll see you next time.
Health is life. Your health matters. You matter. Health begins in the spirit and the mind. Take time to love you. Live well. Be well.
Yeah, let's go.
Health matters to me.
Come on, get up. Cause you tuned into the station for your morning motivation to get your education for your health and your spiritual needs.
Health matters to me.
Yeah, strong will to empower the people, to promote the peace, though. Positive attitudes, behavior, that's the lifelong dream goes.
Health matters to me.
Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be.
Health matters to me.
Yeah, and it's time for this classic, fantastic food for your soul. Here's Jack